Hello, my name is Andriana Petrova and I'm a prehabilitation dietitian at Barts Health. Today I will present our study evaluating postoperative outcomes among malnourished patients undergoing multimodal colorectal prehabilitation at Barts Health NHS Trust. Malnutrition is a well-established risk factor for poor surgical outcomes. Patients who are malnourished often experience higher rates of post-op complications, longer hospital stays, and increased mortality. As a result, improving nutritional status before surgery has become an important focus of modern rehabilitation programs. However, the evidence showing equivalent outcomes between optimized malnourished patients and the non-malnourished patients remains limited. Furthermore, there remains limited guidance on the optimal structure and delivery of multimodal rehabilitation services in practice. The aim of this study was to compare postoperative outcomes between malnourished and non-malnourished patients undergoing multimodal colorectal rehabilitation and to evaluate whether nutritional optimization reduced the excess risk associated with malnutrition in our cohort. We conducted a retrospective cohort study using data from patients enrolled in our service over 12 months. Nutritional status was assessed for all patients by the dietitian using the GLIM criteria. Those who were malnourished commenced oral nutritional supplements under the advice of the dietitian, and compliance was confirmed through close follow-up. Patients classified as mild, moderately, or severely malnourished were grouped together and compared with patients who were not malnourished. Those considered only at risk of malnutrition or with missing nutritional data were excluded. The primary outcomes examined were length of hospital stay, serious postoperative complications, anastomotic complications, 30-day readmission rate, and 90-day mortality. Appropriate statistical methods were applied, including the Mann-Whitney test for continuous variables and Fisher's exact test for categorical outcomes. Statistical significance was defined as p-value less than 0.05. A total of 111 patients were included in the study, comprising of 66 non-malnourished patients and 45 malnourished patients. Our results demonstrated remarkably similar outcomes between the two groups. Median length of stay was 6 days in the malnourished group and 7 days in the non-malnourished group, with no statistically significant difference. Rates of post-op complications were comparable, and there was no significant differences in anastomotic complications, 30-day readmission rates, or 90-day mortality. In conclusion, malnourished patients who underwent colorectal prehabilitation with targeted dietetic optimization did not experience significantly worse postoperative outcomes than the non-malnourished patients. In fact, their length of hospital stay was 1 day shorter. These findings suggest the nutritional intervention delivered within a structured prehabilitation program may help to mitigate the adverse effects traditionally associated with malnutrition and support more equitable surgical outcomes. However, larger prospective studies are needed to confirm these findings and determine the independent contribution of nutritional optimization to improved perioperative outcomes. Furthermore, more guidance is needed on the optimum delivery of those services. Thank you for your attention, and thank you so much to everyone who contributed to this project.